The U.S. healthcare system faces a number of challenges around quality. We still harm too many patients. The quality of care we're providing is subpar, and costs remain too high. Transparency is seen as a powerful tool for addressing many of those challenges. One example of that being done well is the Centers for Disease Control and Prevention and the reporting out of healthcare-associated infections. But if not done well, transparency can be a problem. It can disengage clinicians and hospitals from quality improvement, and it can actually leave patients to riskier care rather than safer care. Our team has identified 5 steps in the measurement and reporting of healthcare quality. The first step is reporting or specifying the measure. What's the numerator? What's the denominator? What are the exclusions? The National Quality Forum has a robust and streamlined process for vetting and endorsing quality measures. However, there's no requirement that any entity actually use an NQF-endorsed measure. The second step is actually collecting the data that populate the measure. But those data often are unaudited. The third step is actually applying those data to the measure itself. So even though an entity is saying it's using a standardized endorsed measure, if they make any change to that measure, whether it be the population or who's included or what's included, you're no longer having an apples-to-apples comparison. And then the fourth and fifth steps are actually reporting that information out to the public and to consumers. Those entities that are doing the reporting can use any sense of performance categories that they'd like. And we've done very little research around how consumers understand healthcare quality information. Our team feels like one opportunity is to take a page from the playbook from the world of financial reporting. The Federal Accounting Standards Board, or FASB, for decades has been reporting out on financial performance, using a set of standards and creating standardized reports that are usable by multiple entities and stakeholders. We believe that a lot of those lessons could be applied to healthcare quality. We think that policymakers can play a key role in advancing this agenda. First, policymakers could fund an entity, a multi-stakeholder entity, that could work together on developing those standards. And then those standards could be implemented over time. Another way that policymakers could be useful is actually helping to encourage and facilitate those entities in the federal government that work on performance measurement to work together and to collaborate, to look for opportunities to make advancements in that way. And finally, the other opportunity for policymakers is to fund opportunities to really better educate consumers about gaps in quality and safety of care, and also help them better understand how that information can be communicated to them.